Now I don't see it.
Yeah, now we can't see the screen.
Okay, there we go.
Okay. All right, so we did our presentation on fall prevention. You can go to the next slide. Our objectives: identify risk factors associated with falls, understand risk factors of fractures, identify and understand the consequences of a fall. One should be able to articulate several ways to improve one's living situation to decrease fall risk, gain knowledge on medications that may contribute to fall risk, verbalize or identify different assistive devices, and have an overall understanding of what one should do if they fall. Next slide.
So we had to pick a Healthy People 2030 objective. You might be wondering what Healthy People 2030 is. So it's a set of data-driven national objectives to improve health and well-being over the next decade. Age is a challenge for the global public health because it increases fall risk, cognitive impairment, and comorbidities. So one objective of Healthy People 2030 is the reduction of the rate of emergency room visits due to falls among older adults. In 2016, approximately 6,052.2 emergency room visits occurred due to the falls per 100,000 adults over the age of 65. So an overall goal of Healthy People 2030 is to decrease the number of falls among aging Americans. And falls can have a direct result of the associated risk factors. Next.
Stace, right?
I was doing 9, 10, and 11, but I can read this one for sure. So worldwide, people age 65 and over who fall at home are 28 to 35% per year, and people age 70 plus are 32% to 42%. According to the Centers for Disease Prevention, Control and Prevention, in 2018, falls were the 11th leading cause of death and the first cause of fatal or non-fatal injury in people age 65 and over in the United States of America. Moreover, the primary cause of emergency department admission and hospitalization. Falls are the leading cause of injury among adults aged 65 years old or greater in the United States. And in 2018, an estimated 3 million emergency department visits and more than 950 hospitalizations are trauma, and approximately 32,000 deaths resulted from fall-related injuries. Deaths from falls are increasing, with the largest increases occurring in persons aged 85 years and older. The World Health Organization has reported falls are a major global public health problem and a worldwide cause of accidental or unintentional deaths after road traffic accidents. Next slide.
So what makes someone at risk for falls? Muscle weakness, balance disorder, visual impairment, dementia, alcohol use, psychoactive medication, and not using assistive devices. In the hospital, we see many people that do not use their assistive devices as prescribed by a physical therapist or their medical professional when they go to the hospital or to their doctor's office. And then there's this little insert here, are you destined for a fall, but you can do these to make your home safer by using the rails, keep your floors clear and slip resistance, which we'll go over in future slides. Use only stable step stools with top handrails, Make sure that you have a list of all your emergency contacts and be vigilant of the list with medications and emergency numbers. Can you go to the next slide, please? Some risk fractures, risk factors for fractures. That's a tongue twister. Low bone density, which is a test that your physician will order once you reach a certain age, probably around 50 years old. They'll order a test to see if, how fragile your bones are, aging in general. If you have a history of osteoporosis, which they can diagnose with that bone density test. If you have a history of falls related to Parkinson's, any medications that you're on, dual diagnosis. If you have a history of drinking, or if you don't have a history of drinking and you have one drink and you fall. Poor diet of protein intake. Your diet changes as you get older and your appetite decreases. So sometimes they encourage you to take or eat those Ensure shakes, get a little extra protein in your dietary intake every day. Decreased vision, as you can tell, I have decreased vision. So it's important to get your annual eye exams. Use of steroids, you're a little shaky with taking medications, hearing impairment, history of rheumatoid arthritis, some environmental factors, which is just what's in your house and in the community, slippery ice. Be aware of what's around you, lack of physical exercise, dizziness or vertigo. Next slide, please.
So there are some consequences of falls, which both manifest in physical and psychological ways. The physical ways that the consequences of a fall can happen are obviously fractures. If you get a fracture, your decreased mobility or movement and the pain associated with that fracture. Or even if you fall and, you don't sustain a fracture, you can have bruise and pain and swelling from that anyways. And then the psychological consequences surrounding a fall, just being afraid that you're going to fall in general or fall again. It can affect your confidence of, getting out and doing activities outside your home or even within your home. And that can further lead to social isolation, a loss of self. If you're experiencing some of these things, that can decrease your quality of life and cause you to have changes in your routine, being scared that you're going to fall, and also have the psychological effect of, your home living in place, but, if you fall, you might be thinking, oh, it's time for me to, move out of my home for assisted living or a nursing home. Next. So fractures in older adults. In North America and Europe, 25 to 33% of older adults who live at home experience at least one fall per year. This rate was found to be higher among older adults in a nursing home setting. Statistically, falls occur at twice the rate of women compared to men. The lower arm and shoulder fractures are the most common sites of fractures in the older population. Lower forearm fractures, which are medically known as distal radial fractures, tend to occur when using the arm to protect oneself during a fall. 2/3 of these risk factors occur outside. Distal radial fractures occur usually in women who have a low bone mineral density, which goes along with the testing that Trisha talked about. and who are active and relatively healthy otherwise. Shoulder fractures or proximal humeral fractures tend to occur from a direct impact of a fall. These fractures occur in women who have a low bone mineral density and who are less active. And these fractures occur to attend more indoors. Upper leg fractures or thigh, which are medically known as proximal femoral fractures, tend to occur while falling backwards. The average age for a proximal femoral head fracture is around 80 years old, and more than 85% of proximal femoral fractures occur by falls. Next slide.
So falls in adults are related to 3 factors usually, and those factors are environmental, lack of physical exercise, and dizziness. So precautions that we can take at home are home modification is one of the best ways to reduce the risk of falls. And a risk assessment can be done by a trained professional such as an RN or a therapist. And this way they can identify any environmental risk factors and individualize a plan of correction to allow the individuals to remain safely at home and reduce their risk of falls. They need to remove any clutter from walkways and use slip-resistant flooring with no loose throw rugs. They need to remove or rearrange any electrical cords or cables that can become trip hazards. Arrange furniture to accommodate assistive devices, and use furniture with armrests to facilitate rising from a sitting position. Improve or add lighting such as motion sensing or use night lights. Adding grab bars and non-slip mats to the bathroom can also help to prevent falls on wet floors or slippery tubs and showers. Installation of a ramp for entry or simply using another entrance or exit with no steps is also an important intervention to prevent falls. Other modifications to the external environment include using safe assistive devices. These should be replaced or repaired if they're broken, and they should also be used in a safe manner. Wearing proper footwear can also help to prevent falls. And if a fall does occur, using a life alert service is helpful to summon medical help. Next slide, please. Other precautions that can be taken to prevent falls include medication management, disease management, and preventing deconditioning. These ways are as follows. Medical providers can perform a medical reconciliation at MD appointments. They can educate about medication side effects and educate to take all medication as prescribed, especially for chronic conditions that affect balance and gait. Continue annual eye exams and report any unusual problems as soon as they occur. Lab values should be monitored, especially vitamin D, as we know those of us in the Northeast, our levels always seem to be on the lower end, and discuss with the medical provider if supplements or medications such as vitamin D or for prescription medications for osteoporosis are needed. Using the restroom regularly will help prevent rushing for toileting. Be aware that postural hypotension may be a side effect of medications, and avoid fast movements. Include some form of exercise into your regular routine to prevent deconditioning from inactivity. Next slide, please. Medication safety. In addition to the external factors that we just talked about, another causative agent for falls is also medication and medication side effects. Older individuals are at risk because of polypharmacy, and medications that increase falls are cardiac medications such as antihypertensive, analgesics, or pain medications, and psychotropic medications, especially antidepressants. Diuretics may cause urinary frequency and urgency, which can increase the risk for falls, especially in those individuals with mobility issues. Chemotherapy may also be a contributing factors for falls because of the effect it has on our blood counts, leading to weakness or fatigue. Also, medications to control the side effects of chemotherapy may also be a contributing factor to falls. And a medication reconciliation and a reduction of any unsafe or unnecessary medication may also be helpful to reduce the incidence of falls. So that should be something when we go to MD appointments that we should talk to our provider about. Next slide.
So the proper use of assistive devices. Here you can see a walker, a wheeled walker. There's a picture of like a life alert kind of device, and then my little lady with her cane. So canes work exceptionally well for balance and stability, but only when they're used correctly. When you use a cane, the load carried by your knees, hips, and ankles is significantly reduced the more weight one puts on the cane, the less work your joints are doing with each step. So make sure you have the correct size cane. Having the wrong size can actually increase your fall risk. It is common for people to want to use a cane on the bad or injured side to take more weight off of the injured leg, but this can really just kind of throw off your center of gravity, making the cane not very beneficial. So using the cane on the unaffected side helps to maintain that center of gravity, decreasing your fall risk. If injuries are so severe that one must use the cane on the injured side, it's likely that they may need to use crutches or a walker rather than a cane. To correctly use a cane, one must make sure they have the correct size cane, and then you hold the cane on the strong or uninjured side. So when you step with the bad or injured leg, the cane moves with it. Make it a habit to place the point of the cane parallel or next to your opposite foot, not in front of or behind, because that would cause you to trip. To maneuver stairs using a cane, always go slow and take your time. You plant the cane and the bad injured leg firmly on the ground. Use the good leg to step up, as stepping up one step at a time. Use the good leg to move forward each time. The bad leg will work with the cane to keep your balance. When coming down the stairs, always use the railing. Have the cane in opposite the injured side, but you step first with the bad leg. So coming down, bad first, going up, good leg first. And make sure correct size. Using the hand opposite your injury and always place parallel to your foot as you step. Next slide. We had talked about exercise and increasing your strength. So attending an exercise class is a single intervention that prevents falls in community living for older adult populations. Exercise is meant to be performed at an individual pace and speed and can be modified for limitations in a slow, positive progression. So you don't have to overdo yourself. Even a little bit counts. If you exercise for 3 hours a week and challenge your balance, it's been associated with increased fall prevention. Exercise class also provides social interaction. Staying active builds strength, balance, and flexibility. We reached out to NORC and they told us how they provide a chair yoga class. It's available on Tuesdays via Zoom at 11. And it just kind of gets people up and moving and not anything excessive. Next slide, please. So you've fallen and you can't get up and you're all by yourself. What should you do? So first, you should stay calm. If you're able to call for help, call for help. It's encouraged to carry a cell phone if you have one at all times. So if you do fall, you can seek help. We talked earlier about Life Alert or a medical alert device that they have that if you fall, you can wear a necklace and push the button, or some have bracelets that goes to a call center and calls for help. those are highly recommended. If you hit your head or believe you lost consciousness when you fell, you will need to seek further evaluation in an emergency room. If you fall and are unable to get up, try to get yourself to a comfortable position and wait for help to arrive. With your personal support system, you should try to make a safe plan and have daily telephone check-ins. Follow up with your primary care provider if you do fall, and after the fall, maybe reflect on why you fell and make modifications to not have this fall happen again. Next slide. These are our references, and if there's any questions, thank you for your attention.
Another thing I wanted to mention, now that we've talked about like precautions that I actually learned this week and I talked about with my physician and family members, is if you have an iPhone watch, an Apple Watch, there's a way to program your phone, and I can actually let you know how to do it, that if you fall hard enough, not that anybody should fall, you can get a notification and it sends an alert to your emergency contacts, and you can designate an emergency contact in your phone under your favorites. And also if your vital signs get to a certain point, if your heart rate gets too high or if your heart rate gets too low, they can also send an alert to EMS or to your emergency contacts in your phone as well. It's just another added service. And there's certain generations that if somebody has COPD or obstructive pulmonary disease or other dual diagnoses, that you can get your pulse oximeter set up also on your watch. So it's just an added benefit. So if you don't have the life alert system, if you have an Apple Watch, it's a nice investment because you can get your messages on it. But if you are an active person in the community, it's just another way to be attentive to your health. That's it.
Thank you.